Hi everybody, Dr. Susan here. I just wanted to talk to you for a minute about our functional blood chemistry analysis that we're now doing as part of our program. Many people say, I already had my blood work done. Most people get their blood work done at an annual physical at the medical doctor. But I have to tell you, the medical world leaves most of the information on the table, because when you get your medical report back, the blood report, the doctor will just quickly scan through it, look for highs and lows, and if you're not out of their range, you're fine. It tells you you're fine. So I realized this a couple of years ago, that people were very frustrated because they knew they weren't fine. They knew they didn't feel fine. This mostly happens to women with thyroid and issues like that. The numbers, the medical standard numbers are so low that you really have to get your thyroid almost not working before they'll tell you there's something wrong with it. It's a little better now, but it's not much better. So it's not the blood work that we do, because we do a basic blood panel on our patients, but it's the analysis that gets done on it. So we do what's called a functional blood chemistry analysis. And what this is it brings to light it kind of makes it like a 3D view of your blood work, because we look in optimal levels, not medical standard normal ranges. And those medical standards, those ranges change all the time, at least once a year. So I don't know if you ever noticed that. People do notice it because they brought it to my attention several times, that the ranges change. So if you have past blood work, you might want to look at those numbers. You'll see those ranges change. Those standard medical ranges are based on an average of our country, which our country is getting sicker and sicker. And I know for me, I do not want to be part of those standard medical ranges that are average of our country, because I want my health to be better than what is normal in our country, standard American normal. I don't want to be part of that, and many of you don't want to be part of that either. So we use an optimal range, which either shortens the numbers, and that helps us to discover dysfunction when something is in dysfunction. So there's a lot of gray between sickness or pathology when something can be diagnosed and called a name and given a medication, and wealth. There's a huge gray area, and that's what we see. We see the gray area. So before it turns into a pathology, this is like a crystal ball look into your future, because we can see things in dysfunction before it becomes a pathology or a sickness. Or sometimes it's already a pathology or sickness, and we can just see how far it is, and we'll know how to help it. So we look in those optimal ranges. The second thing we do is we look at, this is like, I'm just gonna show this picture because we do a functional systems report. So this is one of my old blood reports. I have been managing my health doing this blood chemistry analysis now for six years. So 6 of the 8 years that I've had MS, this has been the way I monitor my health. And I'll show you that because it's, oops. So I can show you what we have, like a history report that comes up at the back of the report that shows you every year all your blood work in comparison to the year before. So you can quickly see, and this is the thing, you can quickly see if something has come into dysfunction in the year's time. So when I work with patients, we usually measure blood and do this functional blood chemistry analysis every three months if there's a real sickness diagnosis type thing. 6 months if they're well, they just want to monitor. But then they graduate to yearly. I have them do yearly blood tests, and I've had people doing yearly blood tests now for many years, and they do it on their family, on their kids, because you can see, even in children, when something's going wrong, it can easily be corrected naturally before it gets to a disease process and a pathology or something requiring medicine. So again, it's like a crystal ball into the future. We trace patterns, we look at optimal levels, it gives you nutrient deficiencies, so you're able to discover so much dysfunction happening in your body. So when you say to me that you went to the medical doctor, your blood work was fine, I'm going to tell you, no, we need to look further, because you need to have this analysis done, because this analysis is amazing. So in the functional world, how amazing it is that many functional medicine practitioners are known for doing a battery of tests, just kind of throwing it all at you. So you walk out with a $7,000, $8,000 bill for all these functional tests. my gateway test has always been the functional blood chemistry analysis, because that's the first thing we do to see where the dysfunction is. And if we can pinpoint if we need an extra test, 1 or 2 maybe, sometimes we don't need any, because all the information comes right here in the analysis. So it's the way functional medicine needs to be done, because it will save people so much money. Like I said, I have used this to guide my health, to guide me back to health from being debilitated with MS. When I discovered this, I started using it right away. It was about 2013, so about 6 years ago. And I tested my blood every 3 months, then went to 6 months, and now I just do it. I still do it mostly at 6 months, but sometimes it gets closer to a year, just to make sure that my body is still where it needs to be, and I'm able to see different things that you don't see in the medical world. So it's an amazing analysis. It's not just blood work. It's a crystal ball view into your future, that if nothing changes, this is where you're headed. Or you can change it, and we can see what you need to change, and then we retest your blood, you see all those red lines that I showed you, they all start to draw back and correct.